Hey guys, I'm Dr. Heath Lampee with Teeth in 24, and today we're going to be talking about one of my most interesting and challenging cases in 20 years of dentistry, my patient, Gary. Gary is about 50 years old. He had come to me because he had no teeth, could barely wear his dentures, and had implants that had failed. Now, Gary lost his teeth in his mid-30s, not due to his own fault, but when he was a small child, he had polio. From his polio infection, he got Guillain-Barré, which is a viral infection that almost killed him. This affected his teeth as he was growing as a little boy, and as he became a teenager, it became readily apparent that his teeth were very weak from the polio and the Guillain-Barré that he had as a little kid. Gary ended up finally losing his teeth from those childhood illnesses. He felt an immense amount of shame, an immense amount of judgment, and he had a dentist make him dentures, but what the dentures did was they caused terrible mouth sores. They didn't fit, they floated in his mouth. He could barely eat anything, he couldn't really smile. Gary felt hopeless. He had a terrible gag reflex from these bad dentures. They were cutting his mouth beyond belief, couldn't eat. He didn't want to go out, didn't want to be social. He was at his lowest when he came to see me. The pain, the anxiety, the gag reflexes, the embarrassment. I mean, it was hard to hear. He finally found someone to give him implants, and his first round of implants that he spent a ton of money for, they failed. He felt so judged, so shamed, that he thought his life was over, especially after his first round of implants failed from the other dentist, after he went to 5 dentists who said they couldn't help him. He really felt life was over.
I've been through it all, and people don't realize the pain you go through to look acceptable. Yeah. To look acceptable and to have people not judge you, but the worst part is you judge yourself.
His lower jaw was so skinny that it was almost impossible to put implants in. His upper jaw, all the bone had dissolved, his sinuses had gotten big, that the only bone that Gary had in his upper jaw was by his nose up here and his cheekbones. These are called zygomatic implants. These are long implants that anchor way up here and way up here. Very technically challenging. And the other thing he needed were pterygoid implants. Pterygoid implants are way in the back where your wisdom teeth used to be on the top. It's also an advanced technique. Very few dentists are really skilled in these techniques, especially when not only is there almost no bone, you're gonna have to use every one of the most advanced techniques known to dentistry on the same patient to finally give him teeth back. Now with his lower jaw, while the bone was skinny, we had just enough bone to squeeze in our 4 implants, but there is a nerve here and here called the mental nerve we needed to avoid. And if for some reason, we were to get too close to this nerve, you could have a permanent numbness in the chin. Now, I've never had that happen, but it's something we talk about with every patient. So for my tried and true Lampee evaluation process, when a patient comes in, we get x-rays. So we get 2D and 3D x-rays to see where bone is abundant. If it is lacking, how are we going to overcome that obstacle? We also like to get photographs because I need to see outside and inside my patient's mouth to see what their smile or lack of smile is like. And also in their mouth, are the tissues healthy? Are they unhealthy? What am I looking at? When Gary came in, his dentures were garbage. I mean, he could wear them for a couple minutes at a time and they were all collapsed and worn. It was the most agonizing smile in a person I've ever seen. So we had to rebuild his mouth. He was totally overclosed. He was like an old man. So we had to reopen him. And my laboratory on site made little prosthetics that fit in his mouth that reapproximated where his bite should be, how open he should be, and then kind of what the teeth should look like. So that was pre-surgical. When one day with Gary, my team and I, with our anesthesiologist, were able to put in 7 implants up top, 4 implants on the bottom. On the top, this very front implant is in something called the incisive canal. There's a hole in your palate that has a bony channel in it. We were actually able to put a big fat implant in there. These 2 implants are actually in the floor of his nose. I actually got in under his nose and put those in there in just this little wedge of bone. And by getting our advanced implants in his top and bottom jaws, we're actually able to preserve the rest of his jaw bones from further deterioration. So his jaws will be stronger over time and he will be able to eat whatever he wants. He's eating the apples, the corn on the cob, the ribs, And that's what he loves. I try to bulletproof everything as much as possible, and that's where I try to go above and beyond for my patients. With Teeth in 24, we're able to immediately load pretty much all of our cases. The bone is very strong, our implant tips are engaged in that very strong bone, and the teeth that we put in there, the prosthetics, actually anchor everything together, so it actually almost acts like a splint or a cast. It's kind of like when you break your arm snowboarding, doing something crazy. The doctor is going to put a rigid cast or splint on your arm. It helps it heal better. The teeth that I gave Gary or any other patient on the day of surgery almost act like a splint or cast, so it actually helps the bone heal better. So that's how we're able to do our immediate load. We don't need to do that delayed loading where, we take the teeth out one day and then 3 months later we put the implants in and 4 months later we finally give you teeth. No, it's all that day. It's all tried and true orthopedic science, basically. Gary was able to go from no dentures, no teeth, failed implants, to 11 brand new solid implants with permanent teeth that day. Gary responded really well and very quickly. Now, the first week after surgery, it's always a little bit sore, everything's kind of new in there. And for my patients who have not had teeth in a long time, I tell them it's gonna take you a month or so to really wrap your head around these teeth, to really own them. I wanted to make sure that if Gary spent time and money with us, that this is going to last for the rest of his life. It meant that much to me. It showed me that I have to really step outside my role as a dentist, as an implant specialist, and understand psychologically, who is my patient? How can we help them? And how can we do this for the rest of their life? How do we let them know that it's all right to trust again? How do we tell them that your life is worth living? The more and more cases, technical cases that we do, these challenging ones, it's fundamentally life altering. And it is the most positive life change I could ever have one of my patients do, because I see it day in, day out. When my patients get their new smiles, their new teeth in 24, this new smile transformation, they tell me, this is the best thing I've ever done in my life. This is the best time I've ever spent. This is the best investment I've ever made.
The only thing I regret is I didn't go see him sooner. I didn't go see Dr. Lampee sooner. If I'd went and saw Dr. Lampee sooner, I'd have been smiling a lot sooner.